understand what I must to do. Okay, hello everybody.
Hello.
Today we will speak about skin. This is a very interesting organ. Оп, оно едет. This is very interesting organ and most important for the body. And you open your slides. Today we will speak about advanced method of scanner therapy for most common skin condition. Then our plan, part 1, we will speak about skin. Skin is the body largest organ, and I remind you about skin, what is his role in the body. Part 2, human body systems. We will speak in this part about system in the body and how system connect with the skin. And part 3, zona of scanner treatment, special zona for skin problems. Part 4, scanner therapy for skin problems, special techniques. And part 5, scanner therapy in special cases. The next page, part 1, skin in the body largest organ. Said my teacher in medical university, we have only one skin disease. This is scabies. Every another skin disease, this is disease of inner organs or systems. And this is interesting. And I would like to remind you about the main principle of the body work. It's the principle of the homeostasis keeping. All options in the body, like the average level of the acid in the stomach, pH and the blood, and so on, are kept in so original balance. This option we call correct options. When the real options are not okay due to some reason, the system of correcting the state must work. It's called the functional system, and which is formed each time once again when that returns the homeostasis state, and which is destroyed afterward when the stability is achieved. The part of the functional system is the following: nervous system, endocrine system, blood vessels system, and skin. And this is why skin, this is a part of adaptive system. And if we have problem with the skin, we have problem with all adaptive system in the body. And now the next slide about the brain in your skin. Skin very connect with nervous system. Why? Because the fact is during our embryogenesis, the skin and the nervous system produce from one embryo leaf. We have 3 levels of tissue: ectoderma, endoderma, and mesoderma. And skin and the nervous system produce from ectoderma. And in the next stage of embryogenesis, the nervous system and the skin will be formed from ectoderma. That is why the nervous system and the skin have the direct close connection between one others. And this means that the information about the pathological changes in some organ is kept not only in the place in the brain. This information is also representative piece on the part of the skin, and connect with the organ in the one hand and with the dominant center in the brain in the another. So when we have effective somehow the piece of the skin, we also affect on whole pathological systems. And all pathological problem reflected on the skin, and all diseases, this is problem with inner organs with reflected on the skin. You understand, yes, how it's connect. And this is why that when we treat patient with skin disease, we work not only with the skin, we work in some organ or system, the first. And we need to know a lot of techniques for this system of these organs. And what is more, we can even learn about some changes in the inner organs while looking and measures somehow the state of the skin surface. For example, the skin impedance of soft plates depends upon the amount of special substances in this place of the skin. And this amount is directly connected with the state of the organ and represented this part of the skin. And while the state of the organ is part of the change, the skin impedance is also change. With the help of scanner, we do not only affect the inner organ through the skin, but we also get the information about the changes in the inner organs from the surface of the skin while checking the skin impedance. And that you understand that our primary signs as a change of color, change stickiness, change of feeling, change of sounds, this is our informational about skin impedance. And if we influence on the skin, we can also influence on the nervous system and on our inner organs. This is biofeedback. When we speak with the body, when we work with scanner, we speak with the body with these signs of small asymmetry and ask the body, where is your active zone across the skin? And skin, for us, this is very important organ for treat all problem with the body. And the next our slide, neurotransmitters in the action on the skin. Skin contains its own nervous system and release neurotransmission locally also and produce acetylcholine, dopamine, histamine, melatonin, serotonin, and neuropeptides also. And we can treat locally also, not only across the nervous system, we also, when influence on the skin, we locally also has effects. Why the patient don't need to take a shower before 2 hours before a procedure, because on the skin we have a lot of also substances, and after the treatment these substances locally work. And skin function. Skin has function, this is page 8, protective, endocrine, immune, thermoregulation, excretory, organ of touch, respiratory function, melanin production, pain sensitive, structure, regulation of blood flow. And for us, very important excretory function of the skin. Because if the patient come to us with any kind of problem, at first begin clean the body from the skin, and can appear a rash or pimples on the skin. This is, we call it secondary size. And we also understand that a body begin clean during our treatment. And we have secondary signs, I told you, stickiness, change of color, change of feeling, change of sounds. And we also have secondary signs. Secondary signs, this is primary signs we have during your work. Secondary signs, this is especially signs which appear after your work. It can be rash, pimple, bruise. Language, body speak with us with secondary signs. And you must understand that any problem with the skin, this is body, this is language of the body. And if the patient have, example, rash on the front of the body, on the thorax department here, this is a hormonal problem with the patient. Every woman with hormonal problem, with gynecologist problem, has here rash. If the patient have pimples on the up on the back, this is problem with a large intestinal tract. If the patient have a rash on their shoulder, on their arm, this is problem with pancreas. And I had one patient, we treated her with shoulder scapula periarthritis, and she had also diabetes secondary type, not first type, secondary type, not insulin dependent. And we work with her only with neck and with shoulders, with this part of the arm, and your diabetes also disappear, normalize sugar in the blood. And body show us special zone when we need to work for different kind of disease also. And every rash, every pimples, this is very important informational for us every time. The next our slide. Page, open page. Human body system. The sodium system reflected on the skin. If the patient has skin disease, we need to know which system is affected and will apply techniques or method for this patient. Example, if this is if this is psoriasis, this is nervous system problem. If this is furunculosis, this is immune system problem. And sometimes with lungs and bronch problem, also a patient have rash or pimples, and we need to treat with lungs and bronx zona and technique, specialty technique. Gastrointestinal tract problems, also some patients come to us with eczema, example, or dermatitis also. This is problem with sometimes with gastrointestinal tract, and we need to treat to special techniques for gastrointestinal tract. And this is why we put this webinar on the end from another webinars, because we need to know all technique which we learned before when we learn about gastrointestinal tract technique, hormonal technique, immune technique, nervous tissue technique. Every technique we will use if the patient come to you with skin disease, and it depends from skin disease. And the first, what we need to do with patient with skin disease.
Йоланта, а там, может быть, кто-то стучится еще. Ты можешь подключить? Потому что хостинг сейчас у тебя.
Никто не стучится, не вижу.
Ольга стучится. Ольга, у нее два подсоединения.
Chat. I can't hear you. You come as your... Ладно, там люди стучатся. Ник, можешь подключить? Что-то я не вижу. Не знаю. I can see, Тамара, я не вижу.
Хорошо.
7 человек в ожидании. Все, уже увидела.
Давай, подключи.
Ого, 1, 2, 3, 4, 5, 6, 7. Все. Окей. Окей. Now I must remember what I finished. I finished it about all system. Yes, all system in the body take a part in our process. Then you have in your slides homeostasis keeping. I told you that skin take a part in homeostasis keeping, and this is part of adaptive system and very important work with adaptive techniques. And at first, what you need to begin your treat, it is better begin your treat from drainage technique which clean the body. I recommend it at first that you understand with skin disease. At first we do adaptive technique, 3 part 6 point as usual. On the second procedure, cleaning technique for clean the body. it's very important because if we don't treat with a cleaning technique, I don't know why I have phone. Okay, cleaning technique, the body begin clean and rash appear more, and it's not good for the patient. Example, if the young woman has acne and you begin treat her with hormonal technique and with face, the pimple appear more because body begin clean from the face. And I recommend it at first begin all skin problem with clean the body.
Yolanta,
Uh-huh.
you can mute everybody on your screen, so you don't hear anybody's noise, echo, or anything.
Yes, it's better.
Or everybody, please mute yourself.
Mm-hmm. Okay, maybe everybody switch off. Okay. I repeat. It is better begin your treatment from clean the body and drainage technique. And we begin our webinar from also from drainage technique. The next, part 3, zona of scanner treatment. And what is interesting for, especially for skin problem, if the patient has a rash on the body, this is the body show you immediately zona for your treatment. Because this is zona of asymmetry, this is zona which different from all the body. We draw this zona till rectangle and begin work from this zona. But if the patient has rash on all body, in this situation, you need to work with the clean skin because this is small asymmetry. You understand, yes? If rash on all body, you look for clean part of the body, and this is zona of asymmetry, small asymmetry, and we work with clean part of the body. This is very important with psoriasis, with patient with psoriasis. Sometimes they has all body with rash, and you will work with clean part of the body. Usually, interesting is that patient with psoriasis has a clean part of the body on the liver. And liver, this is important, the most important zona for the skin problem, with every skin problem. And if the patient has a lot of small zona of the rash, this third options, you ask the patient when the first zona appear, when the first zona, when appear rash, and then begin work from the first zona. This is 3 options. Rash, this is zona of small asymmetry, or clean part of the zona of small asymmetry, or the first zona when appears the rash. And our zona of treatment. Of course, 3 parts, 6 points. Then abdomen zona, yes, because we need to clean the body and or clean or organs which must clean the body as liver, gastrointestinal tract, kidneys, lungs, and bronchs. If suffer some organs, skin begin clean self. And skin takes over the function on cleaning of the body. And if you understand this, and skin rash on the skin, it can be problem with so cleaning organs. And abdomen, neck collar zona, because all zona of adaptive system we work. Liver is the most important zona for skin problem. And the next scanner technique 3 part 6 point, it's you know it. And then liver zona and pancreas zona, and this is page 26. And reciprocal zona for the liver. This is liver on the right side of the front of the body, reciprocal zona. This is left side on the neck. The next 30, page 30.
Excuse me, doctor. Excuse me, doctor. Which technique and setting we can use for cleansing for liver or kidney or lungs, please?
About technique, we will speak a little later, okay? Now,
Okay.
in general,
Okay,
how we work with, and then we have plan. At first, in
Okay.
general, now I explain you about zona, and then we will speak about every technique. Yes, of course, and I show you everything.
Thank you.
Okay, and scanner protocol, and what technique we use for, in general, what technique we use for skin problem. This is lympha technique, cleansing and stimulation drainage technique, scanner technique and method for balancing immune system, scanner technique and method for balancing hormonal system, general balancing technique. I explain you later everything. Zona of general regulation. Every adaptation zona, we need to take a part in this process. What is technique for adaptation zona? This is 3 part 6 point, neck collar zona, forehead and adrenal glands, palm zona, and liver and pancreas. This is our general adaptive zonas. Now about zones. And then page 31, this is also in general example, if the patient have acne, we use predominantly hormonal technique. Slide 31, and you have your slides, and it is better that open your slide self, because if I will open your slides, I cannot show you patient, and we specially make our webinar so that you can see only me and patient, and slide you open self, please. 31, page 31, acne. Acne, this is predominantly hormonal system, allergy reaction. This is allergy of the body, very good, we can treat with scanner. And we use especially immune system zona, liver, abdomen zona, and predominantly this is abdomen zona and liver for allergy reaction. Carbuncle, furuncle, this is immune zona, dermatitis, neurodermatitis, this is gastrointestinal tract and nervous system problem, psoriasis, nervous system problem, and herpes, this is immune system. And you can see that different kind of skin problem, we use different kind of technique. Part 4, scanner technique for electrolymphatic therapy, cleansing and stimulation drainage. Somebody speak with me? Tamara, can you ask about slide? They ask about slides. They ask where slides, and you sent maybe everybody slides, yes? Everybody has slides or not? Yes, okay. Okay, I can continue, yes? Drainage technique. Can we please mute Angela? Can you please mute? Я не знаю, где Ангела. Where is Angela?
Angelo, can you please mute your microphone?
Yes, please.
Okay, drainage technique. The most important drainage technique, this technique on the zona of abdomen. We have the first technique, steering heel. You know this technique. Now I only say the name technique. If you want that I show you, I will show every technique what you want. Steering heel. I show this technique a lot of time, but if you need, I will show you. Projection of the kidneys and C7 or TH8. Scanner technique, lymph rooms, cleansing and stimulation drainage. Scanner technique lamps.
Yolanta, I'm sorry to interrupt. Angelo, can you please mute? I don't think he understands.
I think
but, okay,
the
Yolanta,
host
you,
should be able to mute everyone. Just mute everyone because
Yes.
it's very
Yes,
disturbing.
please, better, please, because we can't understand.
Şeytan kenara çıktı. Takımda çıkıyor.
Aynen onunla geldi sıra.
And Angela, please.
Bir kere geleceksin diye.
Angela.
Okay, I switch off his. Okay, I switch off his sound. I can. I can do it. Okay. For me, it's very difficult to be as a host and to explain you because I need to also think about what I say. Okay, scanner techniques. Today we will learn lymph rooms, cleansing and stimulation. Now maybe you write down if you need some techniques that I show. I only say the name. Urinary system cleansing. This technique I show, urinary system cleansing, because I never showed you. Scanner technique lamps, projection of the kidneys and the 7-9 cycle, 6 and projection of the kidneys and TH8. At this I show you because it's important, and Kaisa asked me about this. Anterior projection of the liver, anterior projection of the pancreas, I show you. And then abdominal zone, steering heel, threes, magic square, the best technique also. For abdominal square, big cross, active lines. Active lines are also very good, and we can use it every time. It takes 5 minutes, okay? And what is technique you write down me? What is technique that you want that I show you? I will show you urinary system cleansing and projection of the kidneys, and C7 and TH8. And a lot of technique on the liver. Also, I show you. Every another technique, if you need, I show you, write down me, okay? At first, lymph rooms, you know this technique. This technique takes 5-10 minutes, and you can use it every time for the patient. Magic square, steering heel, this is page 36. 36, magic square, steering heel, 3 around the navel, active line, big cross, abdomen, you know, yes? I show this technique a lot of time. On the liver technique, I show you urinary system cleansing. And now open the page number, urinary technique. At first, I a little explain you how we will work, and then we will work. We cross. Сейчас начнем. Okay, this is a page number 67. Scanner technique 9 cycle, projection of the kidneys and TH8. This technique very good use when the patient have problem with adaptive system, because we work with adrenal glands also, with kidneys for the cleaning, and with immune system, because TH8, this is a special point which switch on immune reaction on the body. And we can use this technique if the patient have autoimmune problem, problem with immune system and endocrine system combined. We put 9 cycles on kidneys and then on the TH8 and on the kidneys, left, up, and right. I show you later. Then we can also work with this zona with 6B stereo, the same, but here is kidneys, C7 and kidneys. And we can put on this point 6B stereo or 9 cycles. This is the same. It depends from your patient. If we want to relieve pain and improve situation for energy, it is better 9 cycle. If you switch on more reaction, give energy, and work very good with the patient with kidneys and adrenal glands, we can work 6B stereo. And in my practice, 6B stereo, this is not the first procedure, it wasn't the first procedure, relieve protein in urine when the patient has glomerulonephritis and patient had 3 gram on a liter protein in urine. This is too much. And after this procedure, 6B stereo on the kidneys, his protein fall down and normalize. And I like this procedure for a normalized work with kidneys problem. And the next special procedure.
Иоланта, включи, пожалуйста, еще людей, там кто-то подключается. Посмотри.
А как смотреть? Я в прошлый раз как-то включила. Поиск. Я как-то в прошлый раз не знаю, как-то я это сделала. Не знаю тоже. Безопасная запись, чат. Нет, нет. I don't know how. Не знаю. Тамара, а может
Участниках?
быть... Ну, я не вижу никого, потому что она бы мне тут написала. А Володя не может быть керівником? Нет? Я вас не слышу, вы выключили звук.
Пока ты хостинг, мы не можем подключать.
А может, он сделается хостингом? Не может?
Нет, тогда ты не можешь говорить. Он хостинг, ты хостинг.
Ну как, все ж подключаются и говорят. Они ж не хостинги. Они же говорят.
Не сейчас. Давай, продолжай.
Хорошо, ладно. This is a little technique pause. Urination zona, the next. This special, very important technique for problem with kidneys and for the clean with the body and with every woman with gynecology problems. This is the best technique, urination zona. We work with 3 parts. The first part, we work with the zona of kidneys. From the middle axillary lines, as the page 73, we move device and work with the kidneys. From the top to the bottom, from to the left to the right. The second part, we work from the center inside to the outside. We move device. It is better move device not on the vector. It is better move device as a spiral. And very good if the patient have a stone in kidneys, this procedure. And we move device on the urethra till urine bladder. The third part, we move device on urine bladder from top to the bottom, from to the left to the right. And the projection of urine bladder, this special zona which under the palm zona above pubis, and this projection on the pubis. And then lamps technique. Balancing immune, the next part of technique. Okay, now I show you these techniques. Давай сначала садишься, да? Я не понимаю, ничего, как они это все делают, ну ладно. Ну что, садись спину. Да. Now I show you every this technique. Почему? Давай лежать, давай лежать. Да? When we work with the kidneys, patient can sit and can lie. Ну, давай садись сначала. When we work with kidneys and C7, patient can sit. If we work with specially kidneys technique, patient can lay.
Hey, doctor. I have a suggestion for you if you want. I was wondering maybe if you want to proceed with the treatment process, maybe you can show us how the technique is instead of, waiting for the whole process for zeros and stuff so that you don't take much time for you. It's easier maybe for you if you get what I mean. What do you think?
Okay, at first I show you this urinary system cleansing, okay?
Yeah, okay.
Now, switch on device, put comfortable thinking. А как перевернуть? Никто ничего не знает. Так, мне нужно эти самые.
Так, треба все роздягати, чи що?
Ну да, полностью. А как твои мои? Такие вот почки. The kidneys, this is when the scapula, angle of the scapula, we this line must cross this 12 rib, and this point, this is a hole. This is our first point. We put comfortable tingling. Same than enough.
Yolanta, for professionals who have a scanner with preset, what preset are you using right now?
Frequency 60 Hertz and diagnostic 1 and nothing special. This is our treatment procedures. Nothing special. Switch on device, automatically frequency 60 Hertz, diagnostic 1, energy 80, no, 60, and begin our work. We put initial reaction, called 25 and dose. 25. Mm-hmm. 43 dose, then 9 cycle. 33, 30, 33 dose.
Sorry, doctor, which treatment protocol are we doing now at the moment?
We work with urinary system cleansing.
Urinary system cleansing. With the PDF that I
49.
49, page 49.
Here, 49 dose. 23 initial, 25, sorry, initial reaction. I show you later all digital. 25, 43 dose. 33, 30. This is a tooth. We compare tooth. And 49 dose. This is 9 cycle. 28, 30 dose on 30. 28, 30 dose. And we compare with tooth 1, 2, 3, 4, 5, 6, 7, 8. And our vector goes on the clockways in this side. 45, 28, 26, 39, and 23, 31, 31, and then we compare all doses and put 0 on the highest dose. $47, and we have doses. 49, 39, 43, 47, 45, 49 the highest, and we put here, this is this point, put here 0. I don't wait now 0, I only put dose, but we imagine that this is 0. $53. Then we can put this 9 cycles on the TH8 or C7. Well, it is better example C7. 25. $43. 31. 23. 55. Then 29. 25. 29 dose. $43. Then 31, 24, is our first point. $49 and 30, 27, 30, 27, $47. We compare all doses. We have doses 55, 43, 49, 47, 43, and on 55 we put 0. Uh, 49 example. This is 0 must be higher. No, we haven't so much time. And the next 29 initial reaction and dose in the center. This is a 0, but we need to wait dose. $29 initial, dose 41. 31, 28. 31, 28. $41, 34, 30, dose on 34.
زيارة هي في إضافة يعني
45, 35, 33, 35 dose. Uh, 49 and last here 30, 32, 32 dose. And compare all doses, and on the highest we put 0. Then we compare 3, 0, and on the highest 0 we put FMR, 2 minutes. Mm, 47, and we have doses 41, 45, 49, 47, 41, 49 the highest. And we put here 0. Zero is 51. We have 30, 53, 49, 51. And on 53, we put FM var, them var, and FM plus, and put here 2 minutes FM var. And we have here 1 line. This is the second line. And this is the third line. If we work with 6-bit stereo, we put the same, but we have 6 position of device. Here is 9 position of device, and we will have 6 position of device. TH8, how we find it? This is angle of the scapula, and line between 2 angles here, TH8. And we also can work with this region with 9 cycle or 6-bit stereo. One minute FMR, and we will wait 2 minutes FMR. Wait. Painful point. I find specially point for this. Yo, very painful point. If you have any questions about 9 cycle or and 6-bit stereo, you can ask now. Kasia, you understand this method?
I understand.
Okay, you asked me about this.
Oh no, it's not me. Oh, Katya, maybe.
So I was just asking Yolanta, the fact that all zeros were on the top part of each area, does it mean anything for interpretation, or we just leave it at that?
The sounds is not good. Can you say once more?
Okay. Can you hear me better?
Not good. More loud.
Can you hear me better now?
Yes, now better.
Okay. Okay. So the fact that all the zeros were on the top part of each section, is that an interpretation of something in particular?
Yes, all section you need to look for the highest dose and put there 0.
Yes, but in this case, in this particular case, all the zeros were in the top part of each of the kidneys and the C7. Does that mean anything in particular?
Yes, for example, I don't know because this is not real patient, but she told me that this point is very painful. I find your painful point, and maybe she has a little problem with kidneys. And yes, every hour 0 say us where is the more active zone for this patient. Example for this patient, more active zone with kidneys, and you can see on all 0 red spots. On the neck, no. Yes, neck is good. but here and here we have red spots. This is,
Okay, so
yes.
just activation point.
Yes, activation. And after you're working, of course, after you're working in diagnostic 1, we switch device in diagnostic 0 and frequency 90 hertz example, we change frequency for subjective regime. And we can work with this zone with subjective regime, or this is signs of smaller symmetry. We work in 4 vectors and look for more difficult, for me, more difficult thickness here in this side. And we work till opposite signs. Thickness must disappear.
Hey, doctor.
And symmetrical point, you can see that the next 0, this is symmetrical point. This is our first rule of scanner therapy: pathological point, symmetrical point, and corresponding segment of the spine. We can work after you're working in diagnostic 1 with diagnostic 0. Now I use first rule of scanner therapy: pathological point, symmetrical point, because symmetrical also will be 0, was 0, and corresponding segment of the spine.
Doctor,
You
can
ask
I ask
me?
you a question? So see, you done for the cross thing, up, down, left, right, the brushing. So do you normally should do it like this, or is it like up, down, left, right, slowly, or what's the movement in the direction that you've done the crossing? The proper way of doing what you've done just earlier.
This?
Yes, correct.
This is 4 vectors, which
Perfect.
we look
Sorry,
for
yes,
more
perfect.
difficult vectors. The first, this is main vectors from
Yeah,
up
because
to down, yes.
yes, true,
The
because I've
next
seen you just
opposite
doing it up.
vector we check may be thickness more in opposite vector. The next we move device another side and another side and look for more difficult vector, because sometimes the first vector is not very important, and this vector is more difficult for me.
Yes, so focus on
and
up.
she say me, oh. And I work with this vector because this is the body show me this vector is more difficult.
Yeah,
Mhm.
the
Thickness.
device is stuck.
I find pathological point because I don't especially this is not patient.
I think she
But
drinks too
now
much.
this is my patient. Okay, and the next very important technique for the kidneys. I like this technique. We move device frequency 90 hertz, example. We move device on the kidney zona from middle axillary lines from top to the bottom, from to the left to the right 3 times. And look for signs of smaller symmetry. 1, 2, and 3. I especially show you how we must do it. Then symmetrical from top to the bottom, from to the left to the right. 1, 2, and 3. Then we can change your frequency, example 120 hertz, and move device as the urethra goes. It is better move device. Move device with spiral. Okay, it is. Okay, move till Till pubis. So wait, 1, then 2 on urethra, and 3. For us, very important signs of small asymmetry, this is a change of color, because kidneys work with the blood, yes, clean the blood. And blood vessels, this is on the skin, if we have red spot or wild spot, this is pale spot, this is the reaction of vessels, and we need to reaction of vessels. And a red spot is more important for us than stickiness and nausea. And symmetrical side, move device this. Then the patient must lay on the couch, and we will work with zona of the pubis. This is zona of the lower than palm zona. This is how we can do this procedure. This procedure we can do every day as additional procedure if you need to clean the body. Example, for alopecia, this is we need work with kidneys. A gynecology problem, this is acne, also we need to work with kidneys every day. And how we will work. Example, I show you the first option. The second option, also special procedure of the kidneys. We need to change frequency. This is special cleaning procedure. The first, we put frequency 15 Hertz. Why 15? You remember 15 Hertz, this is more irritable frequency. 15 Hertz, comfortable tingling, and move device from the middle axillary lines with frequency 15 Hertz. Only vibration, it's enough. And sounds, if you can hear, sounds is very strange sounds when 15 Hertz. More irritable frequency. You can see very low energy. She doesn't feel energy, but a lot of red spots appear. So frequency will stimulate the organs. If you need to very good stimulation something, you can put frequency 15 Hertz. And appear a lot of red spots. Enough, then appear signs of small asymmetry. Then symmetrical zona, frequency 15 Hertz. 1. Very slowly. And you can do this procedure for yourself also. Very good procedure for clean the kidney zona and urethra and urina bladder. 2, 3. And then we change frequency on 40 Hertz. If you remember from primary school, 40 Hertz, this is 30 and 40 Hertz. This is special frequency for stimulate the walls of the vessels and stimulate also urethra. For stimulate urethra, we use frequency 40 Hertz. And then move device. So lay as a urethra go till pubis. 1, 2, and 3.
Doctor, did you change the setting now?
It is better. do this procedure when the patient lay. Yes. But I begin to show you sitting also you can work, but it is better when when we work with kidneys and with ureter, patient can sit. But if we will work with pubis, must lay.
He asked about settings, parameters of the device.
Did you change it?
At first 15 hertz.
And now?
Then 40 hertz.
Okay.
For ureter, 40 hertz. 3 times. And then the patient must lay. And the third, we put frequency 70 hertz. This is frequency to stimulate inner organs. When we work with intestinal tract, when we work with pancreas, it is better put frequency 70 hertz. You remember that we, when we learn gastrointestinal tract, we put frequency 73 hertz. This is special frequency for worms take off from the body. No? And pubis, we move device 3 times on the pubis. 1, 2, and 3. And look for signs of small asymmetry. When we find signs of small asymmetry, we put frequency 500 hertz, and we can. It's enough for cleansing. But if we want to treat the kidneys, you can work with signs of small asymmetry. With signs of small asymmetry, we work with frequency 500 hertz. Frequency 500 hertz. This is now I write down everything. Frequency 500 hertz. This is intense 7. Intense 7. Delay 10. Gap 10. And amplitude 10. Energy 10. And with this frequency 500 hertz, we work with signs of small asymmetry.
Sorry, doctor. How do you put 500 frequency? Because for device we don't have 500 hertz frequency.
Yes, and if we want to have frequency 500 hertz, we put intense 7.
Okay.
Gap 10, and amplitude 10. And you will have frequency 500 hertz.
What's amplitude?
Especially give you parameters for 500 hertz. And we work with...
Amplitude is energy.
Energy, yes.
These signs of small asymmetry, and I work... thickness. I check. Now it's better. Then here signs of small asymmetry. I check. Good, good. This side here. 1, 2, 3, 4. This. Окей, переворачиваемся. Нет, нет, понятно. Я ищу signs of, I look for signs of small asymmetry. Here, a little. Okay. And if the patient haven't signs, and here a little signs of small asymmetry. Okay, now I write down all parameters. Это холодно. No. And first, we work with frequency 15 Hertz with kidneys. Second, with ureter, we work with frequency 40 Hertz. Third, we work with frequency 70 Hertz with urinobladder. And small asymmetry, we work with frequency 500 Hertz. This is intense 7, JEP 10, and energy 10. These your parameters for working with kidneys. Okay. And very good this procedure also for kidney stone example. You move device in the retro with frequency 40 Hertz, or if this is very acute pain, 300 Hertz. You remember for return relief pain, we use frequency 300 Hertz. The next we're cleaning zona, liver, and pancreas. Okay. Now, zona of the liver. And this side, I draw this zona, this linea axillaris media, then on the rib, then liver go on this side, and this is finished. Zona of the pancreas, one setting of device here, the next on umbilicus, and so way we go to the middle axillary lines. This is zona liver and pancreas. Especially zona for the liver. For the with liver, we need to work every procedure. Now I show you how. Example, you will work with zona liver and pancreas.
عمل frequency تبعه بس بالضبط
ما اعرف شو قالت
With liver, we can work on quadrats of abdomen.
الشات فوتينا بالحيط انت حجي ايش اصفر احمر
ما هي حتى الالوان كلها ترجع جنبها بتلون.
This is questions or what?
I'm sorry, guys. Would you mind to keep quiet when Yolanta does her explanations, please? We can't hear anything from you. Thank you.
Okay, good.
Sorry guys, I didn't know that the mic was on. Sorry.
Okay. Zona liver and pancreas. Zona quadrats red, quadrats on abdomen. And we can work with liver, also 9s, 3s, and 2s. And now I show you how. At first, zona liver and pancreas. We put comfortable tingling. Do you feel tingling? Frequency 60 Hertz. And diagnostic 1. And work with from middle axillary line, initial reaction, 28, initial reaction, 27, 28 dose. Now I very quickly show you how we work with this zona. 43. And we have 28, we need 29 and 22, 35 those. Compare those 0, and so way we go till this last point. And those. Then we work with contrast, initial reaction, 25, 22, 25. Those the rule of the first difference. Then we need 26 and more different on 1 unit, and go till middle axillary lines, last point those. This is zona liver and pancreas. Quadrats of the abdomen, the same. This is the first quadrat, we move device, and this is last point. The second, we move device, and this is the last point. This is your second options. The third options, example, we work with the liver, and we have one difference and last point dose. No difference, body doesn't work well, liver doesn't work. What we can do in this situation? We can work with meridian of livers. This procedure work very good if the patient have hormonal problem, immune problem, problem with any adaptive system, and with skin problem. Liver meridians goes on the middle line of the body, and this is a middle line. This is clavicle, and from clavicle, if we divide clavicle into parts, and across the breast, and this is middle line of the body, and under the breast, when the sternum is finished, this is our first point.
Sorry, doctor, which protocol page is this in the PDF?
You have in your exercise book, you have this technique. This is 6B stereo on the liver, and on the one side and another side.
$37?
I show you a little later when we open our slides. I show you this technique.
No
now
worries,
I show on the patient, okay? Every technique I show on the patient, then we will see on the slide. This is 6B stereo. We put initial reaction, 37, 31, 37 dose. Six B stereo is not easy procedure, but very, very helpful and very good for treatment. And with any kind of problems, we need to work with this procedure, because this is liver. This is organ which is responsible also for all process in the body. And sometimes liver doesn't, very often liver doesn't work. 51 dose, then 37, we compare with the 37 and we do nothing. Then 33, we compare with, at first, with second position, 31, and 33 is higher, we put here dose. Then 37, we compare with 33 and also put here dose. But at first, we put dose on 37, because this is the third point and this is the fourth point. You understand? 1, 2, 3, 4. Every time we put dose on the previous point, the third is higher. And we put here dose. With 6B stereo, every time we return to the previous state and take off problem for previous state, then return to the previous state and take off problem from previous state. 6B stereo, everybody knows, yes? Oh, silence.
Silence maybe means yes.
Yes, okay.
Yes, we know it.
Okay. 51. 51 do nothing. And 33. Uh, 55. And we have 55, 45, sorry, 45, 51, 51 is higher, and we put here 0. If we haven't enough time, you can do instead 0 dose. It's also good. This is not treatment procedure, but this procedure accelerates reaction in the body. But if we want to have a treatment reaction, it is better wait through 0. Now I haven't enough time for true 0. I put dose, and it's also good. Sometimes I work so way when I want only speed up process. 51. 39 dose, because 37 and compare 39 dose. $51. Oh, you can see 51, 51, 51. Oh, body doesn't work well. 29, we compare with 31, 33, 39, 31 is higher, and put here those. $47, and 47 we compare with 51, put here 0. Then we 47 compare with 45 and put 0 on 47.
Can the cameraman stand like the opposite way directly to the patient instead of the other way around?
One moment, I finish it, okay? Because I count the digital also. 55, 0. And we need to put here 0 and compare zeros. Camera. Может так? Now is better.
Maybe down to the other side. So if he can switch the camera to so that it can face the patient, so that we can see your hand directly to the like maybe just he goes down to the left.
Okay, thank you. 47. Okay, 47. And we have 0, 55, 51, 47. On 55, we put FMVAR 1 minute. And finishing. We did everything with this digital. And we will do the same 6B stereo on the next side. And you have the 3 options work with the liver. Example, 1 minute. If we do 6B stereo, we do 1 minute FM bar. Okay, and then we do the next side. I only show you how we 1, 2, 1, 1, 2, 3, 4, 5, 6. And we work on this scheme. This is how we work with the liver. The third option, the fourth options. After you working example 3 part 6 point, you work 30 minutes and we need to work with liver also. We move device, look for the signs of small asymmetry. Thickness here. You remember that we move device 3 times and look for signs of small asymmetry. Second and third. For me is here is more thickness, this point, and I put on this point 5 minutes FM bar. This is also sometimes we call it vaccination on the liver. 5 minutes of FM bar on the most active point on the liver. And you can do it also after some procedure, because you need to work with liver every time. Or 2 minutes of MR, it's also good, but every day when the patient have problem with the skin, every day we need to work with liver. Okay, example 2 or 5 minutes FMR. How we can work with liver more? We can work with 3s. What it means? We put initial reaction 30, initial reaction 30, and initial reaction 25. 1, 2, 3. If we do the 3s, 30, 30, 25, we put those on 230. (30, 25). On all 30, we put those. And so way with 3s, we work with the liver till last point. We have a lot of doses in this procedure, 37, and on the second, we have a lot of doses and put 0. Then we work with these quadrats also 1, 2, 3, 1, 2, 3, 1, 2, 3, and in 3s we put doses and a lot of doses 0. 2, 0, put FM bar 2 minutes. This is also the options for work with the liver zona and zona of abdomen. When we work with 3s, when the body doesn't work well also, when the I told you that during from my experience, people who has problem with adaptive system, his liver doesn't work well every time, and we need to switch on liver in the work. If the liver work good, this patient having this problem. 31, 32, 25, 32, 31, 32, 25. I only show you, I don't do this procedure, show you how that you understand how we work with 3s. Okay? Everybody understand? Oh.
Yes, we do, Yolanta. Thank you.
Okay, thank you. Okay, now I finish it with those 41. Example, we have a lot of those here, a lot of those here, 0, 1, 0, 2, and F and var 2 minutes. The next options, you can work with liver zona with 9 cycle. We put initial reaction, 30, and dose. When we do 9 cycle, when the patient have complaints with gallbladder, liver usually haven't pain because liver haven't new tissue. Liver pain only when the liver become bigger with hepatitis, and usually liver haven't pain. And if we have, if the patient have pain, this is problem usually with gallbladder. 31, 26. Now you will know a lot of options how work with liver. And liver also immune organ. And now after coronavirus, patients have a lot of problem with liver. I had one patient, he came to me with bronch problem after 43, after coronavirus. 33, 24, and she told me that she made echography and your liver was as very poison liver after toxic. And liver suffered very much after infection. 45. 33. 24. And if you work with liver, this is the first organ which react on the scanner very quickly. After 2 weeks, after you when you finish it, your treatment, and after 2 weeks make analysis of the liver become better or normal. $45 and 28, 27. Here those. And you can make this 9 cycle 1, 2, 3, or this quadrat, or all this zona of the up on the umbilicus, and work with 9 cycles. $39. And we have a lot of doses, 43, 45, 45, 41. We have 245. The first, this is higher, and we will put here 0. I especially show you different options that you, during your work, sometimes if we have two similar, for you, very difficult to understand what is higher. And this is the first, because we work 1, 2, 3, 4, 5, 6, 7, 8, and this is the higher, and we will put 0 on this. I write down 1, 2, 3, 9 cycle, and you can do more. It depends from your time for the patient. And if you need to work with pancreas, it is better make more 9 cycle and 0. Okay, example. Okay, and you can also work with 9s. 9s, this is 1, 2, 3, 1, 2, 3, 1, 2, 3, and on the 9, 0. Okay, it's easy, I think. Have you any questions about work with the liver? Okay. Make now a 5-minute break, and after 10 minutes, it is better 10 minutes, we will speak about more interesting procedure, Vita. Vita, it's very interesting procedure, and I prepare to this procedure, and after 10 minutes, okay? 10 minutes break.
Thank you, doctor.
Просто не понимаю, спешу, что там. Слушай, я не понимаю, кто она сделала? Что ты тут вообще такая? Что ты натыкаешь? Я не разумею. Все, Господи. Ну что это такое? Can see our open page number 80, and you can see special procedure for also immune system, hormonal system, and adaptive system. And our next technique, scanner technique for balancing immune system. And the first technique which we learned today, this is Vita. This technique we use when the patient have very old chronic disease. Skin disease, every time old chronic disease, because when appear rash on the skin, must at first be solve problem with inner organs. And this disease develop usually 5 or 10 years when appear a rash on the skin. Then also we use this procedure when the weak patient, when the patient has problem with autoimmune disease, with immune system, with autoimmune disease. This is break in immune system. And we have 3 parts of this procedure, Vita 1, Vita 2, and Vita 3. We can do this 3 parts in one procedures. It takes 1 hour. I check now. If we haven't, so it's too much. Sometimes it's too much. And we can do with the 1 and with the 2 on the first day and with the 3 on the second. Or we can do some procedure and with the 1, some procedure and with the 2, some procedure and with the 3. This procedure takes 20-15 minutes. With the 1, with the 2, with the 3, the longest. With the 1. Now I explain you and then we will work. We work in thorax department of the back. We begin under the C7 and finish it when the ribs on the 12 rib, line of 12 rib. We put initial reaction and dose in the center every time. Then we compare 2 position 2 and 3 on paracentral near the first procedure, and put on the higher we put dose if 1 initial reaction, the highest initial reaction higher than the first. Then for 5 also we put dose if initial reaction higher than the center. I show you now. When we have 3 doses, we put 0. If we haven't 3 doses, we do nothing. And we work our general rules. When we have higher initial reaction, we put dose. When we have higher dose, we put 0. We work our vector higher and higher. We switch on reaction in the body and show the body we need that the body works. With a 2, example, the page 85, initial reaction 20 and dose 36. And the next 2 we compare on paracentral to initial reaction if higher initial reaction higher than the 20, 21, 22 and higher. If we will have 19, we do nothing. Example 18, 19. 20, 21, dose 30. Then 39, 26. 39 is higher than 20, and compared to initial reaction on the higher we put dose. We have 2 doses and put 0. And so where we go till 12 rib. Then we put page 87. We have a lot of 0. Compare all 0, and on the higher 0 we put FM bar 2 minutes. Vita 2. We put initial reaction and dose in center. And then we compare to initial reaction on paracentral, but if the initial reaction, the highest initial reaction is less than the initial reaction on the center. Then we compare also initial reaction 4 and 5 and put those if the initial reaction less than the center. Example 20, 36 dose, page 90. 20, 21. 21 is higher than 20 and we do nothing. 18, 19. 18 is less than 20 and we put dose 26. And then we put FM bar on the highest, then we put 0 on the higher initial higher dose, and then we compare all 0 and put FM bar on the higher 0. And what we do with Vita 2, we break the brain in the body, because usually we work and try to show the body that I need to hire something higher, higher, higher. But if the body haven't enough energy, and we try to put 0 on the and dose on the last initial reaction, on the last dose, and we show the body that or you can have reaction on the less reaction in the body. And then we also show the body that we need to work with the highest. Every our action, we speak with the body, and you must understand what we do, and the body answered on your action. And Vita 3, the most interesting Vita, we break the immune system in the body. We put initial reaction and dose in center. Then we switch off device and count 1, 2, 3, 4 position, and then from 4 switch on the on device and work from 4 till 1. And we compare all initial reaction and put those also on the less initial reaction, lower initial reaction. Lower, and on the lowest dose we put 0. The right side is the same, and we have 0 and put FM bar on the lowest 0. Okay, now I show you how we work. Oh, okay, page 95. Example, center 20, 36 dose. Then we count 1, 2, 3, 4, and then 20, 21, we do nothing because 21 higher than 20, 19 less than 20, we put dose, 19 not less than 19, and we do nothing. Then another side also, and on the lowest dose, we put 0. And so where we go till 12 reps. Now I show you this procedure. We begin under the C7. This is C7. This is 12 week. Comfortable feeling. No. No. Okay, Vita 1. Initial reaction. Diagnostic 1. Initial reaction. 43 and dose. Then paracentral, 38, 34 or 38 dose. Oh, sorry. This is Vita 1. We do nothing. 35, 32. We do nothing. I especially show you why. Because 43 is higher and we need initial reaction higher than the center. And 38, 34, 35, 32, we do nothing. The next. 42 dose. $59 and $41, $37, $36, $36, $41, $37, $36, $36. $38 those. Let's see. 55. Then 39, 39, 39, 39, too similar, we do nothing. And 39 higher than 40, 38, 40 dose, 40 dose, but we have only 2 doses, but our rule, we need to have 3 doses that put 0, and 0 we don't put. $63 dose. Then 39 dose. And so way we show the body is the body show us the higher reaction we work. If reaction is less, we do nothing. 59, 43, 40, 43 dose. Видно, да? Вот это. Що ти пишеш? Ні, не видно. Я не можу все захопити. 43, 40, 43 dose. Dose is 67 and 43, 38 dose, because we compare 43 with 39 with the center. And now we have 3 doses and we put 0 on the highest dose. $67. We have 1, 2, 3 doses, and on the first is higher, we put here 0. 67. Example, this is 0. This is dose, but we haven't timed it. Wait. And the next. 37. 50, 57, 40, 39, 40, higher, put here those. 39, 40, 39. 59, 41, 37, those. 59, too similar. 59, 59. The first is higher, we put here 0. Oh, 61. Next. 39, those. 59, 37, 37, we do nothing, and 37, 37, we do nothing. And last, 33, those. 51, 36, 33, 36, those. 53, and 38, 38. We do nothing. We need to have a difference on 1 unit. In this situation, we do nothing. This is beta 1. The next beta 2. We can immediately work with beta 2. The center initial reaction 38 and dose. 55. Paracentral, we need to initial reaction less than the center, lower. 35, 35. And we need to initial reaction lower than the center and different on 1 unit, and we do nothing in this situation. 35, 35, and 33, 31. 31 is lower. 3, 31, put those. We have 35, 35, we do nothing, 33, 31, and on the lower initial reaction, we put those. $55. And center, 40, those. $59. And central, 42, 60, 36, 42, 36, 36, lower than 40, and we have difference, and we put here those. $53, and here 36 and 36. Too similar. We do nothing because we need to have a difference on 1 unit. Next, 39 those. $59, 36, 36. Too similar, we do nothing. 40, 37. 37 is less than 39, and we put here those. Remember that thorax department of the back, this is zona for immune system and autonomic nervous system. When we work with this zona, we work with immune system and autonomic nervous system. 57 center, 39 those. $59 and paracentral, 41, 39. 41, 39, we do nothing. And here, 44, 38. 38 less, and we put here those. You can see that the higher doses and 0 on the left part of the body and lower on the right part of the body. This is disbalance in the body. 59. Next. 37 dose. If we will work with Vita, every time you will have a lot of red spots because you stimulate the body. Doesn't matter energy. 52. And paracentral. 40. 38. We do nothing. And 43. 38. We do nothing. In initial reaction higher than the center. Next, 38. $55. 37. 37. 38. Those on 37. $55. 33. 37. 33. 53. And we have 3 doses. And on the higher, we will put 0. The higher is 55, the first on the center. For example, 54. 54, 0, and plus 40. Oh, sorry, those 40. $57. Central, 41, 41, do nothing, 41, 38, 38 dogs. Those is 57. And compare all 0 and put FMVAR 2 minutes on the highest 0, but we have only 1 0 and we do nothing in this situation. With the 1, we put 0 on the highest, we put FMVAR on the highest 0 of 67. Here we haven't highest 0, only 1 0. And with the 3, we put initial reaction and dose center. 37. Dose 57. And then switch off device or the side of device, we count 1, 2, 3, 4, and put initial reaction 38, 36 dose, 38, 36, doesn't matter center. We compare all initial reaction from 4 till 1, and on the lower we put dose 36, and we need the next 35 and less 55, 35 dose, $55 and 36. Nothing. Then 1, 2, 3, 4. Put initial reaction 35, 35, 34.
Is this Vita 3?
Yes, this is a Vita 3. $51 and here 34. We do nothing. Doesn't matter how many doses. We put a 0 on the lowest dose. The lowest is 51. Example, if we have here 55, the lowest is the last. This is the first, this is the second, this is the last. And we put here, but here is 51, this is the lowest, and we put here 0. 1, 2, 3, 4. example 0 is 52. The next initial reaction 37 dose. $57 and 1, 2, 3, 4, 40, 40, 35 dose. $61, 39. We do nothing. Then 1, 2, 3, 4, 40, 41, 36. Mhm. $59 and 35 dose. $55. We have doses 61, 57, 55, 59, and the lowest 55, and we put here 0. $59. Then center 37 dose. $55. 1, 2, 3, 4, 41, 42, 42, 38. $59. 1, 2, 3, 4, 40, 38, dose on 38, 57, 35 dose, 55 and 36. We have 59, 55, 55, 57. This 55 is the first, this is the higher, and this the lowest, and we put here 0. $57. Then initial reaction 40 dose, $60 and sorry, 1, 2, 3, 4, 47, 45, 63, 44, 65, 42, 63, 1, 2, 3, 4, 41, 43, 40, 57, and 38. Those. $59. Compare all doses and on the lowest put 0. The lowest is 57, and we put here 0. $65, 37, 55. Then 1, 2, 3, 4, 47, 45, 59, 42, 49, 39, 59, and 1, 2, 3, 4, 42, 39, 57, 39, 38, 59, and you can see that the lowest dose is on the center, 55, and we will put here 0. $57, 38, 55, 1, 2, 3, 4, 37, 34, 'This procedure also breaks my brain because I every time look for the highest, those highest 0, 53, 35, and 38. 1, 2, 3, 4. 40, 39, 59, 38, 55, and 37, those. 57. Compare those. 53 is the lowest, and we put here 0. $55. And last 38. Those. $53. And 1, 2, 3, 4. 41. 38. 59. 38. 34. 51. And 1, 2, 3, 4. 41. 40. 59, 40, it's 39. $56. And the lowest dose is 59, and put here 0. $51 example. And we compare all zeros and put on the lowest FM bar 2 minutes. We have 52, 54, 57, 65. 51 is lowest. Yes, and we put here FM bar minutes. How we count? 1, 2, 3, 4, 5, 6, 7, and this point, the first. Okay, example with bar 2 minutes. With a 1, we put a FM bar on the highest zero. With a 2, we put a FM bar on the highest 0, but we have only 1 0 here. And with a 3, we put FM bar on the lowest 0. Okay. Have you any questions on the Vita?
Hello, Dr. Yolanda.
Hello.
Yeah, so Vita 3, you were, when you had the central dose, the initial reaction and central dose, and you were going from position 4, 3, 2, 1, I kind of lost you a little bit at some point. So you were going, if the position number 4 was higher than the initial, than the central, you didn't dose. But then you look for the lower numbers going from 4 to 1, right?
In Vita 3, okay, in Vita 3, doesn't matter initial reaction, we don't compare with the center.
Okay.
We don't compare.
Oh, okay, okay.
We only count 1, 2, 3, 4, and from 4 we compare 4 and 3. 3 must be lower, 3 and 2, 2 and 1. Then 1, 2, 3, 4. Center doesn't matter.
Okay.
What is sense these procedures with a 1, 2, 3? Center every time works, but every chronic problems and problems with the skin, this is not center, this is peripheria. And if we have a patient come to us not with a complaint on the central nervous system, usually they complain on the organ, internal organ, the chronic disease. And with this procedure, we work with the bodies, and center every time works.
I understand. So the position number 4, the first peripheral, you don't compare it at all. You never dose it then, right?
Yes, yes.
Unless
We
it's
don't
slower.
compare with the center.
Okay. 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 It makes sense. Thank you. It's very hard for my brain to follow.
Yes, it's hard, and for the patient brain also hard.
I can see
and
that.
why this is a sense, these procedures, because usually we work with the higher reaction, we compare and look for the higher, and every autoimmune problem, this is break in immune system, and we need to, this is this procedure of Dr. Rivenka. He developed this procedure especially that also switch on immune system and a little break our attitude to our treatment. It works.
I can feel it.
Works very good.
Okay. I have another question about the previous seminar, so I don't want to ask now. Maybe later.
Okay.
So,
Lanta, it's the same here. May I ask you a question as well, please?
Sorry, the questions from previous webinar. Okay, I am here.
okay.
Question is,
how about if I wait for the previous?
Почекайте.
Okay, Yolanta also have a question. What about if after Vita 3, for example, maybe 1 or 2, the patient get any acute symptoms after that? What do you normally do to neutralize them?
What the patient will have after these procedures?
What my question is, if the patient has any acute reactions or any like a returning of the pain or worsening the pain, what do you do to neutralize the pain in that situation?
I don't understand.
Okay, I'll repeat slowly again.
Pain after procedure or what?
Yes, if the patient is worsening, if it's getting more acute, and then you have an issue, what do you do? Okay.
This procedure not exacerbate procedures, accelerate procedures. Not. This procedure helps the body normalize immune system. After Vita, we never have aggravation or pain problems. Not. Because we don't push reaction on the body. Not. We change reaction. It is different.
I see.
After hormonal technique, I show you a little later, hormonal technique. We will have, every time we will have more painful reaction. This is special hormonal technique number 1. And if we have schools before, maybe 5 years ago, we call it Yelena. This is special procedures. But now we call it hormonal technique number 1, hormonal technique number 2. Because if the patient have hormonal problem as a gynecologist problem, example, endometriosis or kysta, varicose, women haven't complaints, and we need to push the body, aggravate reaction, and women will have more acute complaints, and we work with relief pain or something else. And Vita don't painful procedure. This procedure work with immune system, and after this procedure you will have improved situation. And Vita, we don't work on the first and second procedure. We work after your 5 or 4 procedure. Usually, the maximum which we can work on the 3rd procedures, because at first we need to switch on adaptive reaction and work with 3-part 6-point and work with cleaning procedures. After that, you can work with Vita.
Amazing. Thank you so much for the explanation. Thank you.
Okay. Welcome. And questions maybe from previous webinar?
Very quick, I don't want to take time. When the technique Yolanda 1, Yolanda 2, do we do it like those two parts? Do we do it on one day or on the separate days? I know.
Several days,
On
or
separate days.
Or choose. This is choose that you have a lot of options. You can choose maybe today you do these procedures, and the next day another procedures, or only one procedures, and patient will have effects, and it's enough.
Okay. Thank you.
Not on the immediately two. No, this is options. This or this.
Okay, but not like right side and then left side on the same day. You know, it's just too much. Like the Yolanda technique. Yeah, you showed us. Okay, thank you.
Okay, we'll continue. Now open your Сейчас я посмотрю, что еще. Now open your slides, and maybe slide the next our slide number projection of the liver. I show you projection of the liver. Here you have a lot of techniques. I told you that you will have all technique on the liver. This is ninth page 105. This is ninth cycle of the liver, and then specially technique for nervous system. And this technique we can use if the patient have problem with skin, because neurodermitis, dermatitis, psoriasis also problem with nervous system. Sympathicus vaccination. Maybe you ask me what is difference between sympathicus vaccination and parasympathicus vaccination. Usually during our treatment, we work with parasympathicus vaccination, because for every chronic disease is more active parasympathicus, and we need to work with parasympathicus. With sympathicus, we work only if we have acute situation. Example as urticaria, yes, we can work with sympathicus, but usually patients don't come to you with this difficult problem. They go to emergency with this problem, and we with sympathicus vaccination we work very seldom. But very often we work with mostly sympathicus. I recommend it work with this procedure. I showed this procedure on the previous webinars, and this procedure works very, very good when we do mostly sympathicus. When the patient hasn't dynamic, hasn't good results, when the patient have chronic problem, when the patient have a very bad psychologist situation, and every time this mostly sympathicus help. Every time on the next, if you see that the patient don't satisfactory your procedures, if we do mostly sympathicus on the next procedure, every time patient come to you and say, oh, now I feel better. Every time this works, mostly sympathicus works very good. Small ropes, the page 110, small rhombus. This procedure also hormonal and immune procedure, and we can work with patient, with women who has hormonal problem and rash because has acne example with hormonal problems. If you want, I can show this procedure, but I showed this procedure a lot of time, and maybe if you want. Okay, the next. Lymphaticus waves. Also very good procedure for clean the body, and I like to work not the move device on the lymphaticus, special lymphaticus pits. I like to put device on 2 minutes or 4 minutes FM bar. 2 minutes, 2 minutes, and for arm, yes, 2 minutes. And the same on the ingualis throat and on the popliteal and on the wrist, also 2 minutes.
We
You
use
can-
lymphatic lymphatic preset we use for this technique.
Yes, yes, you can use lymphaticus preset. Yes, it's best, the best, because
Yeah.
why we use presets? Because every time we need to switch on our parameters of device. In preset, every time you have the good parameters for these procedures. Yes, preset is the best. Yes.
Покажи им какую-нибудь волну одну.
Okay, but you ask me if you want to show something, you ask me please, because we have a lot of procedures today. We haven't enough time that I show you everything, but even for one participant, I show. If somebody wants to show something, I show. Okay, Вася, садись, пожалуйста.
Так, я также,
Майку снимай.
ну, также всегда чешу.
Example, if the patient have problem with skin on the on the abdomen, example, or on the thoracic department. If the patient have rash on the leg, we work lower ways. If the patient have problem with above umbilicus, we work this ways. If the patient have problem with the example psoriasis, here now I had so patient here and here, especially rash, and we can work with lymphaticus ways, this arm example and this leg. You have a lot of options in your booklet how we do ways. Okay, I show you how I do, because on my school recommended I put FM plus, recommended put FM or swing, and move on this part of the lymphaticus knots. But it's not very comfortable to move here or yes, wow, you see, and here. And from my practice, I put device 2 minutes on every point. 2 minutes here, then very slowly move device, 2 minutes here, very slowly move device. 2 minutes here, then go on the other side here. Then we move here and here. Example, if we work with the arm, this, and ingualis fields, then можешь так немножко встать. And then for support the term.
Повернуться може, бо
Example. Okay. Patient, it is better if the patient lay here and then here as a spiral. And then here on the inner part of the wrist. Okay, the next Pirogova rings or immune rings on the neck. You know these procedures. Scanner technique for balance hormonal system. I told you about hormonal technique number 1 and 2. This is very good technique, and after this technique, every time you will have some painful reaction, but it's good because usually we do hormonal technique if the body doesn't work, and you need to complaints because we work with complaints and we push the body with this technique, but it's not very acute pain, a little painful, and this is zona when we need to work because with pain our body also speak with us. Hormonal technique. Everybody knows this technique, yes? Example, if the patient you treat patient with acne, this disease we need to work with especially gynecology zonas in the men also. This is you have with page 126 and 127 gynecology zona, inside surface of the hip and outside surface of the calf. Also collar zona and reverse collar zona, it's very good procedure. Also this is hormonal procedure because collar zona innervation thyroid glands and lower collar zona innervation testiculus and tabaricus. Now I show you. Берешь, пожалуйста. I like to change everything in this procedure. Example, I work with neck collar zona with a special attachment electrode, or you can work with subjective regime, and then the patient sits. When we work with collar zona, patient sits. Then we work with collar zona on the cloth on the back. You change parameters, diagnostic 1 example, and the patient it is better laying. Now, collar zona, and very often example, a lot of patients who have problem with ischiadicus and or with loaf on the back, you have activity on the neck. Here we put 0 FM bar example, or patient have problem with neck and the loaf on the back because these two zones are very connect between one others. From the neck, we need to stretch the body and loaf on the back become better. And the same, if we relieve tension from the loaf on the back, neck also become better. And this is our two opposite zona. We put comfortable feeling. And I like to work with amplitude modulation 2 to 1, FM plus, diagnostic 1, everything fluctuation, and work with special position neck collar zona. Feel those. And so we go 1, 2, 3, 1, 2, 3, 1, 2, 3. Do you see here the contracted of the muscles? I like this contracted. I show you how it works. And then 1. Oh, here also very good contracted. We work till those.
So Yolanta, what preset number is that?
I put amplitude modulation 2 to 1, 1, 2, FM plus, and diagnostic 1. You can put amplitude modulation and diagnostic 1. Okay, 1, 2, 3, 1, 2, 3, 1, 2, 1, 2, 1, 2. Okay, that you understand how we work. This is our zona neck collar zona.
Just we waiting for the dose, yeah?
Yes, those. But I show you quickly, okay? Because we haven't.
Better, yes, better.
Okay. Once more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay. Okay, and then patient lay on the couch, and we will work with reverse color zone.
Лягати чи?
Да, ось комп'ютер забирай.
Як?
Хочеш.
Ну, типа на спину, на живіт.
На живот. А ти з тої сторони будеш працювати? Да. Так же лучше, ні?
Ну, я тоді йду до тебе, чи що?
Да.
Ну, так просили. Просили.
We begin.
Просили знімати з тої сторони, звідки ти працюєш.
Ну, спочатку я ту сторону, потім ту я буду. We begin here from the left to the right and reverse neck collar zone. We begin from the right and to the left. Можна чуть-чуть ниже? Чекай, тільки камеру налаштую. Одну минуточку. І мої ті самі помастери.
Там вон.
Ага. Our parameters: diagnostic 1, frequency 60 Hz, everything switch off. And work. Initial reaction 30, 28, 1 setting of device on the center we miss. Сильно? To the script lock. 43 dose, then 27. We need 31, 35 dose. $45. We put principal higher, okay? Or you want high and higher? Okay, high and higher. is the best principle for treatment. Вот они включены. Звук. We have two doses, and on the higher, if the highest next, we put 0. Example 49, 0, then 34, 31, 34, 31. We need 36 and more. 36. $49. Here is 45. 49 is higher, and put here 0. Oh, very good principle, high and higher. This is the best principle for treatment. If the body works this principle, we can say that the body can treat itself, and this very good prognosis principle. Mm-hmm. 53. This is the higher 0. If compared to 0, this is the higher, and we put a finger here 2 minutes. And according principle high and higher, we begin all again after FM bar. Okay, example, FM bar 2 minutes, and then we continue our work. 32, 31. The rule of the first difference we can return only according to the rule of the first difference. Then we go only forward, never back. The dose 45. 33 dose, because we put dose on 32. 33 is higher, and we put dose. Forty-seven. 47 is higher than 45. We put 0. Oh. 51. 31. 27. And 30 last point. 47. And we finish. And we work 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And the same we do on the next side. 1, 2, 3, 1, 2, 3, 1, 2, 1, 2, 1, 2. Okay? Все, можно вставать. This neck collar bone and reverse. Да, конечно. And the next page is a balancing technique. Oh, balancing technique. My favorite procedure, 5 elements of balance energy. If somebody wants, I can show this procedure. It's the best procedure for balance everything in the body. And vaccination, sympathicus vaccination, parasympathicus, liver vaccination, energy basic vaccination. This is also the best procedure.
Which number, sorry?
135.
Yes.
Basic energy vaccination. I every time want to say you that this is the best procedure. It takes 5 minutes and every time has the beneficial effect. And when we do this procedure, when the patient is without dynamic, with very low immune system, autoimmune process, on the first procedure, you can do it. Very often, if the patient have disorders in autonomic nervous system, and I see that this patient need to this procedure, bad sleep, we can do on the first procedure 3 parts 6 point. After that, make this basic energy vaccination. Put your finger on the thorax department of the vertebra. When the most painful point, put 5 minutes FMR. Very simple.
We would like to see that. We would like
Yeah,
to
you
see
see that. Yeah. Last year.
You
year.
like to see? Okay.
Yeah.
Okay.
I would like to see it if you don't mind.
If even one participant like to see this, I make it. Okay? Давай. I show it very, very quickly. With this, I like do this with this finger. Some scanner therapists do this procedure with doses. We put doses, but I like do it with the fingers. This is most informative for me. Push your fingers on the vertebra. Скажешь мне, где более болезненная точка? Or ouch here. And нормально все? We can do once more. Out. Once more here. And on this point, put 5 minutes FMR. And finish. So.
Thank you so much, Jolanta, for that demonstration.
Okay. Moulin Rouge, if you want also, I show you this procedure, also very good push the hormonal system and all adaptive system. Meals, a lot of meals also very good for normalized metabolic and hormonal immune system. Motley sympathicus, the best technique also I told you, and John Eric. John Eric, this is a special procedure which developed for the patient who has problem with autoimmune problems. And this procedure, the sense this procedure, if the patient has problem on peripheria and his complaints is improved, but on peripheria leave rash or some symptoms, John Eric improve your work. We do this procedure on the last of your course of treatment, not beginning. You can see that the course of your treatment is almost finished, and on the complaint on peripheria is leave. You can do John Eric. Eric John we do when the patient not satisfactory your treatment, and you can see that treatment is good. You see that effects is you have effects if compare how patient come to you and now, and your patient sometimes say that, oh, it's not good, I leave my complaints, and you can do Eric John. This is a little another procedure. If you want, I can show if, but I showed this procedure on last webinars. But if somebody wants, I can show once more, because it's the first time I show this procedure and maybe you don't understand the bell very good, and I can show once more.
Yes, I would like to see that.
Okay.
Thank you.
Because now I show very quickly. I don't show every procedures. I show that you understand how we practitioner you can do it.
Так.
Все тут. We work in thorax department of the back, but we work till 12 vertebra, not till 12 ribs, till 12 vertebra. 12 ribs is here and 12 vertebra is here. What is difference? 12 vertebra, this is autonomic nervous system work. 12 ribs, some procedure we work till 12 ribs. We work also with immune system because we switch on adrenal glands. And kidneys also. John Eric. Okay. We put initial reaction on the center. Frequency 60, this is our treatment frequency. We put initial reaction on the center, 29 and dose. Mm-mm. 43. Then we put initial reaction on paravertebral, 23 and 22. And if this initial reaction is higher than the center, we put dose. This is a little similar how we worked before. If this initial reaction is less, we do nothing. In our example, on the center 29-43 and on paravertebral 23, 23, yes. And our example, we do nothing. Then 28. 43 dose and 30, 27, 30 is higher, 30 is higher, and we put dose. This procedure has two parts. This is the first part, 41. 33 dose. At first, we switch on reaction on peripheria, on the not on the center. Center will work, but we show the body if the peripheria is higher than the center, we will work. If less, we do nothing. We try to switch reaction on the peripheria now. 30, 27, 30 is less, we do nothing. Then 32, dose. $43 and 33, 33. Higher but too similar, and we do nothing. 1, 2, 3, 4, 5. If we forgot when we put device, we can count 1, 2, 3, 4, 5. 31 dose. $43 and 35, 33, 35, higher than 31. And we put here once more dose.
А як довго тримати?
Все, так, чтобы посмотрели. Сейчас я напишу тут тоже. And 43 dose. Usually this is a 6th position of device for that. Yes. And the last 28 for adult people. This is 6th position of device when we do in thorax department work. $37 and 29, 32, 29, 32 dose. remember we make our previous procedure, and the left side more active than the right side. You need to notice this in your patient, what is side is more active, what is side is less active. 43. And the second part, we begin your work from paravertebral and put those 22, 23 those. And then we put initial reaction on the center. If initial reaction is higher, we put once more dose. Is less, we do nothing. $33, $31 dose. $42, then 31, 28, $41 and center, 31. We do nothing, not higher. 32, 31. Пофоткать. 41 and center, 31, do nothing. Then 34, 31. $45 and center, 31, do nothing. 35, 31. We switch on the inferior higher than the center. And 45 and center, 33 and the last, 31 33. $44 and center 29. And then we compare all doses from the center and put 0 on the highest dose. Highest, this is the first 43. Compare all doses on the left side and put 0. The first 45 is higher. 0, and compare all doses on the right side, 44, and put here 0. And we will put here 0. Without FM bar, this is not treatment technique, this technique which change reaction of the body. $45. Then here's the 4 position of paravertebral. I count 1, 2, 3, 4. We need to do 2 parts. This is procedure include 2 parts. 45 and 6 position. 1, 2, 3, 4, 5, 6. $43 and finish it. This is John Eric. Eric John opposite. We begin from the paravertebral and compare with center, and the part 2, center and paravertebral. Okay. Сейчас посмотрим. Now, 5 elements of balance energy. I also show you a lot of time. Also very good pages. Scanner technique, basic energy vaccination I showed you. Sympathicus, parasympathicus, stereo threes. Meals and threes on the abdomen, maybe you know. This is not difficult procedure, but also this procedure work very, very good for metabolism, hormonal level, immune system, because intestinal tract, this is also work with immune system, mostly sympathicus. You need to know this procedure because work very, very well. John Eric John, you have on page 165. You have this procedure, zone of general regulation. This is your position of devices, 170. After the first procedure, you can see where is the active zone when the problem on this patient. Example, if we put 0 on the first position, this is arms and nervous system. The second procedure, bronch and lungs. The third procedure, this is the heart. This is average because this is average patient. The children, we will have another position of device, or small people or very tall people. But approximate, you have make diagnose after the first procedure, and you can see where is the active zone for this patient. But I recommended you with patient with skin problem, don't work with active zone. You do the first procedure. After that, we will do procedure for cleaning of the body. After that, you can do some procedure for hormonal level or immune level of the body. Only after then work with zone of complaint. Not zone of complaint, zone of after the first procedure. If we immediately begin to treat the patient, your complaints of the patient can become worse, but it's normal. The body begin clean from the face or from the abdomen or something else. But it's also not bad. But it is better at first clean the body. After that, your course of treatment will be more soft if we clean the body at first, and after that we'll treat the patient. And also that you understand that if we treat patient with skin problem, our treatment will be as a ways. At first we improve your work and rash disappear or become pale. On the third, on fourth procedure, can be more rash, and then less and more. It's normal, and you, if you know it, you're not afraid that you do something wrong, and you know that because body cleans away. Better, worse, better, worse. At first we improve situation, then clean the body, improve situation, a little clean the body. And now maybe a little quickly we look special cases. Yes. Special cases, psoriasis. Psoriasis, this is problem of nerve tissue. I had a lot of patients with psoriasis and recovery. Sometimes they have recovery when they go to the sea on 3 months, on 4 months. But with psoriasis, they cannot be on the sun, but they was on the sun and his psoriasis become better. And this disease very depends from emotional condition of the patient. And Scenar work with emotional condition, with psychology problem, and we need to work with nerve tissue. Our the best zona for nerve tissue, this is thorax department on the back. And also we need to work a lot of our working on the liver and gastrointestinal tract also, and kidneys. Now I had a patient, but I only begin his treat, and this is procedure which I do this patient, the page 198. At first, of course, I make 3 parts 6 point, and you can see that this is principle higher technique number 1. We put initial reaction, compare doses on the then paravertebral. This is a soft procedure, not principle higher. Principle higher, we immediately after last point put 0, and technique number 1, we put a lot of doses, and then 0 on the center, 0 on the left side, 0 on the right side, and then put FMVAR. And FMVAR we put on the neck, if you see, and a lot of activity on the abdomen and zone of the left kidneys. And I didn't work of the neck on the second procedure. If I have this patient with any kind of problems, I work on the neck on the second procedure. But with psoriasis, I told you that I work at first, I clean the body. And on the second procedure, I made a steering heel. You can see this is the second procedure with digital. And steering heel was very quickly, and I also make 6B stereo on liver and pancreas. This is procedure, liver and pancreas. This is, I show you this 6B stereo on the left and on the right side on the liver. On the third procedure, I make 3 liters, but it takes 1 hour, I told you. It is better don't do this procedure on 1 hour. It is better make Vita 1 and 2, and on the next day, Vita 3. But sometimes I make experiments. Treatment of eczema is the same. This is problem with nerve tissue, and we will work and this innervation of the skin. And we need to improve nerve tissue, improve the mood and the psychologist problem of the patient with mostly sympathicus, parasympathicus vaccination, work with the liver also, and take off toxins from the body. Alopecia. What is peculiarity for alopecia? Alopecia, this is problem every my patient with alopecia has problem with kidneys. Even sometimes stone in kidneys, sometimes some problem with kidneys. And with alopecia, I told you that we need to work with special kidneys procedure, which I give you. And we work on the head. And here we see that a special attachment electrode comb, but alopecia, and this is a skin without hair, and I put device on alopecia and different kind of regime we use, and work minimum 15 minutes on procedure and 20 minutes. We need to work long time on this part of the skin, because this is zone of asymmetry. This is immediately zone when we need to work. It is better if the patient have home device and patient work with alopecia and you work with adaptive system and kidneys.
Dr. Yolanda, with alopecia, working on the scalp, what frequency would you use?
Regime, at first I use regime frequency 300 Hertz. Then I use, this is for improve blood circulation, and amplitude modulation 3 to 1, that switch on vessels. Then we can change frequency on 180 Hertz. This is special frequency for normalized nerve tissue. Then I use frequency 90 Hertz. This is for treatment frequency, and change amplitude modulation. Then we can use FM, then we can use swing and presets. Presets also we can use, because any presets, because in preset only change different parameters. Our task on alopecia change every time your parameters. Change every parameters. And at first we begin from the higher frequency and then low frequency. Switch on reaction on the body and then treat with low frequency. Even frequency 15 hertz, this more stimulation frequency we can also use. I recommended today everybody probably try to frequency how I show you 15 hertz, 40 hertz, 500 hertz on yourself. This is very interesting frequency because this is frequency which vibration, different vibration, and you can try because it's interesting how it's works.
What about the meridian for alopecia, please? Because we have a kidney meridian, bladder meridian, liver meridian, and gallbladder meridian. Can we do at same time this all meridian and lungs meridian and large intestine meridians? Can we do and at the same session, or every day we can do just one meridian?
It is better use meridians what we need. We show you meridians, yes. It is better use meridians when we need for the patient. If this is alopecia, we only show you that alopecia why appear because here is a liver meridian, and this is why we need to work with liver zona. And a lot of my patient, example, women, usually this is women who has migraine. This is very popular disease, a very big headache. And what is interesting, we try to relieve headache from the head. But when I learn about meridians, and here is gallbladder meridian, and when the women has problem with gallbladder, they have headache, and very good relief headache from liver. We work with zona of gallbladder, and headache disappear quicker and better than from the head. And this is why we show you meridians, that you understand that problem with soul organ, as the kidneys, as a gallbladder, problem with organs. Also, when we have problem with organs, we have problem with these meridians, and this is why appear this alopecia or rash or somewhere, and we need to work also with these organs. But you can work additional with meridian. If you want one meridian, it's enough. Or we can work with a special balancing method I showed you last time, but I don't know, have you in this with meridians also balance everything in the body. When we put device on kidneys meridians on the front of the body, everybody maybe know this procedure, yes, go down, and then stomach meridian go up. This is balancing every function in the body.
Or you can use those five. We find which meridian out of balance.
Yes, we can use it. And the best for meridians, the best technique, 5 elements of balance. You have this technique in your booklet, in your slides. I told you that this is the best technique. If you want, I can show this technique very quickly.
Please.
I don't
Please.
do this technique, I only show. Okay,
Yes,
very
please.
quickly. But now I finish it with special cases, and then last show this technique, okay?
Thank you.
And alopecia, and what we have once more, acne. Yes, acne treatment. We can treat this patient very good, because this is hormonal disorders in young people. Yeah, please do. Hormonal disorders in the young people, and this hormonal disorders with hormone testosterone. This is why a lot of young men has acne, and women who hasn't enough women hormones, and this girls have a lot of testosterone. This maybe do the sport or very aggressive women, and less women hormone. If the women have enough women hormones, estrogen and progesterone, women has very good skin. And these women, men like these women who has good skin. If the women, this is our natural shows the man, these women have a lot of testosterone, and this women is not good for you. This is why I only show you how it's work in natural. And when we equal the hormonal level in the body, the skin become better. And if we understand this, it's not necessary to work with the face. It's enough work with the hormonal technique, hormonal method. What is more, we also do so mistake. We begin work with the face, with women who ask us, please, I want to have good skin on the face. We begin work from the face, and we a little work with adaptive system, and during our treatment, face become worse. Everybody clean from the face, and his face was worse. But I met this patient after the 1 month after the treatment. They say, "Oh, my face become better," but it's not necessary to do this. And for the acne, it's not necessary to work with the face. Yes, you can put device on the pimple, but it's enough work with adaptive system, with hormonal system, with special gynecology zones, and we will have very good results. Okay, now the last, I show you 5 elements of balance. Ляжешь, Вася, быстренько? Я очень быстро покажу. Сейчас покажу по точкам. Что, ляжешь? Да. С той стороны. Что легче?
Так?
Нет.
Нет. Это возвращается.
You can open your page 140 and 139.
Так сюда поставь. Ты не будешь понимать?
Наверное.
Вася, куда? Так вон, лежать.
Нет,
Ничего, возьми. Капец. Можна приймати буде читати. Десь, якщо ти вихідний, а це чаще здається вихідний.
Не видно, ну что ж такое. А вот он. I look for my attachment electrode. If we have an attachment electrode, doesn't matter. You can put every point with special point with device. Покажи меня, пожалуйста. Я не буду такого. We can also use this procedure for yourself. This is the best procedure. We put this electrode between finger 1 to 3. This is vessels meridians, or we put on the patient, and with this electrode you can work on yourself with special point. I show now point, okay? Parameters of your device. Amplitude modulation 2 to 1, FM plus, and diagnostic 1. Tingling, I like to put 22 because we will work with the face, or 19, doesn't matter. And special point, you have this point, and this point change all 5 elements: trees, water, metal, fire. And especially we change these elements and change 2 setting of device or electrodes we put on the one side, then 2 setting on the another side. The first point, this is processus xiphoideus, this is pancreas meridian here, and we put here the first point. We put those. Every this point, this is point of meridians, and this is painful point. This is the first point. This is element. You have special scheme of elements. This is a tree of earth. А можешь мне табличку показать? Чуть-чуть ниже, ниже. Или выше? Ну, ниже сначала. Вот так? Ага, да.
Doctor, can we use this electrode?
Sorry, what?
Can I use this electrode?
Просто холодный.
Yes, we put this electrode. Зажми.
Я зажал. Так.
Вот. If we have an electrode, you can work with device. On this point, put device. Just time. First point and put those. This is earth. The second, this is on the face. This is a fire. This is a small intestinal. You have special scheme, and on this scheme, every meridians you have. The first, this is pancreas, meridians first, then fire on the face, near the ears. Position on the one side to another side. The next position, this is here. This is kidneys, meridian. This is a water. The next, lungs, meridian. Three. The third, sorry. The third, this is gallbladder, then water, then metal, and every position you have in your skin. 6, 7. Okay? Or it's not necessary that I show everything. Maybe 12 position. This is pericardium meridian. This is if we have mammary glands here, and this is this point outside on the mammary glands. This Okay.
Yolanda, can we use a double facial electrode for this procedure?
Double electrodes, but double electrodes doesn't work with point. It is better use device. Put on all this point 1, 2. We can also work with device, and it's not bad, but better device, because we need to work with the point. This is special point.
Электрод карандаш, который называется карандаши, их 2.
Так, я их и использую. Или которые с двумя штучками.
Нет, нет, наверное, новый выглядит по-другому. Вот который Мохаммед показывал.
Да, а какой он показывал, покажи.
Mohammed, could you show us your electrodes?
Show me electrodes. Yes, you can use. Okay. I specially show you this electrode. I specially show you that because I can change. I have also 2 similar this electrode or to this electrode, but I specially use this electrodes for the 5 elements of balance. If we have 2 similar this surface, we put one on the fingers and another. This electrodes, you can work with the points. Yes, you can work with the points, but this this surface is wider, and I every time work with the pathological point. This electrode is smallest, and you need to know exactly this point of meridians. Okay.
Okay, thank you.
This is why I use more wider, because this is a 1 point this on meridians, and if we know how goes meridians where this point, it's good. Yes, this electrode is better. Okay. They very hard work. I am tired. I don't know how you, but today we work very much, I think. But skin disease, this is disease when we work with every technique, with every what you know, we need to use everything.
Yeah, I have a question. So I totally understand the skin and body connection, but in the US, we have certain regulations for cosmetology field where we actually cannot treat internal organs, but we can work on the chest, neck, and the face on the skin. So if I'm I'm a cosmetologist in America, so I cannot, treat the liver and organs, but can I still use Scenar therapy in my cosmetology treatment and say that it's going to improve the acne, or you think it's not going to give me any good results?
You can work with the face. You can work. I told you, you will have good results, but with more pimple on the face at first, because the body begin clean from the face. Or you can work at first 5 procedure with gastrointestinal tract, with cleaning technique. After the 5 procedure, on the 6th procedure, you begin work with the face. Yes, of course, you can work with the face. It's not contraindication. But I make a lot of my experience during my patients, and if we begin immediately, yes, we want to improve face, and we immediately work with the face of the patient, and situation after the 3rd procedure become worse. And we understand that at first we need to clean the body. work with gastrointestinal tract, with kidneys, with liver, but I don't know exactly what is the better zona for you, and it depends from the first procedure, from your complaints, and maybe you need to kidneys cleaning or gastrointestinal tract cleaning on liver zone or immune zone, endocrine zone, and after the 5 procedures, on the 6th procedure, you can work with the face, of course.
So how often would you schedule your patient to come back to improve the situation, first with acne, for example? Like once a week or every 2 weeks to start? Like to start seeing improvement?
Improvement begin after the 3rd procedure.
Right, but so how often?
Improve and skin improve. Every my patient, even not with acne, every my patient notice that after the 3rd procedure improves their skin. And for the full recovery, and we need to with acne, and this is hormonal problem. I told you that this is not problem with the skin. Yes, this problem with the skin, but this is hormonal problem, and hormonal problem we cannot treat so quickly. It must be 2 courses of treatment on 3 courses of treatment during the maybe 3 months or 4 months.
So once a month would be a good time frame? Once a month?
Once a month, yes.
Yes, okay, thank you.
Okay. Oh, thank you very much. Thank you for everybody for your patience. Thank you, Tamara. Thank you, Olga, for translation.
Thank you.
And we will meet in future and ask questions, because according to your questions, I will prepare for you interesting webinars. Maybe the next webinars will be more interesting than these webinars. And see you in future.
Thank you.
Thank you.